Hope you are doing well, my dear friends. So the topic for today which we are going to discuss is yoga for asthma. So how the yoga helps into the asthma, what are the causes, what are the symptoms, and what are the different types of asthma that we are going to discuss today. If you're talking about the asthma, the term comes to your mind that the problem with the breathing. So it has to be connect with some respiratory system, that is your breathing system. So in asthma, generally what we say, there is a hyperventilation, right? Hyperventilation, inhalation is okay, but exhalation becomes more different. So it causes more tightness in your intercostal muscles and leads to the hyperventilation, and the patient or the client, mostly you have seen that are more mouth breathers, and they work on their breathing with the reverse breathing pattern. So pattern of breath changes, rather to it comes from the diaphragm, it comes from the chest muscles. And mouth breathing and more faster breathing, like this happens. So if we come to the next slide now, after the yoga for asthma, so let's talk about the respiratory system, that we have a different organs. We have a nasal cavity, that air passing over the mucous membrane of the nasal cavity is moistened, warmed and filtered. So as we said that in the respiratory system also, it filters, moisten and humidifies your air. Then if we come to the next one, then we have a pharynx or throat is located where passages from the nose and mouth comes together. So here you can see, this is the part, right, where it connects together, the nose and mouth connects together, passes. Here we call the epiglottis. In between this is the epiglottis, which is just below this pharyngeal area. So it is, epiglottis is the flap of elastic tissue. It is a flap of elastic tissue that forms a lid over the opening in the trachea. So that forms a lid over the opening of the trachea here in the air pipe. So it's basically the basic function of the epiglottis to prevent the entry of food to enter into the air pipe. That is your trachea. That we have a larynx just below, that we call the voice box, is located between the pharynx and the trachea. So trachea is here, pharynx is here, it is located in between the trachea and pharynx. So it contains two ligaments. What it contains, the two ligaments, that the vocal cord that produce sound when the moves through them. So the vocal cords, the vocal cords that produces a sound. When we're trying to do something like, if you are doing you feel the vibration around your vocal cord area. And also it is responsible for the production of sound. Then we come to the bronchial, that the bronchiole. So bronchiole, inside the lungs, the bronchi branch into smaller tubes called the bronchioles. So it is inside the lungs. When the trachea divided into the parts, it's like a root of the lungs, right? The root of the trachea, which is divided into the primary, secondary and tertiary division. You can see it here also. So many branches of this bronchiole. So this is, alveoli is there. This is, we call it the base of the lungs, the grape-like structure that we call the alveoli. At the ends of the bronchioles are bunches of alveoli, air sacs arranged like grapes on a stem. Then the trachea, from the larynx, air enters the trachea or windpipe, which leads towards the lungs. And we have a bronchi. The trachea divided into two tubes that we call the bronchi. Right bronchi, left bronchi. So the right one enters into the right lung, left one enters into the left lung. So this is the brief review of your respiratory system. So now you can say this is the healthy lungs over there. The healthy lungs, you can see bronchi, all are healthy. So there is no change in the color, and the space is in between your bronchioles and bronchi. Now if we come to the next slide, after the respiratory system, so applied anatomy and physiology. So we divide into the two tracts. The one is UURT, that we call upper respiratory tract, upper one. The second one is the lower respiratory tract, that is LRT. So in the upper respiratory tract, we have a nose, nasopharynx and larynx, lined by a vascular mucous membrane with ciliated epithelium. So we have a nasal passage here, nose. This is the nasal pharynx area, and the larynx. Up to here is our URT, upper respiratory tract. The nasal passage, pharynx and larynx. It comes to the upper respiratory tract. Lower respiratory tract is starts from the trachea, that is your air pipe. Then you have a bronchi, right bronchi, left bronchi, and lined by ciliated epithelium as far as terminal bronchioles. Up to the bronchioles. Here we have lower respiratory tract. So this is the division of your two tract. Sometimes we say the problem comes to the URT, upper respiratory tract infection, lower respiratory tract infection. So it is how we diagnose it, which is the structure that is involved and where is the inflammation exists, right? The structure which is involved and where the inflammation exists. So sometimes lower respiratory tract get inflamed, but it also does affect your upper respiratory tract. Sometimes upper respiratory tract gets inflamed and it affects your lower respiratory tract too. So this is your, what we can say, the applied anatomy and physiology about it, that upper respiratory and lower respiratory. If we talk about the lungs over there, so lungs is the one structure, right? Lungs is a one structure, so it divides into the parts. Like if you can say, in the right lung, if you look at here, in the right lung you have a right upper lobe, middle lobe and lower lobe. But if we can go through this one, so in the left one, this is the upper lobe and lower lobe. There is no middle lobe because there is a cardiac space, right? There is a cardiac space for the heart. So the shape of the left lung is little bit different. So if we go to the next slide after the applied anatomy and physiology, so larynx and large bronchi are richly supplied. Our larynx, the voice box and large bronchi, which divides from the right bronchi to the left bronchi, are richly supplied with sensory nerve receptors involved in the cough reflex. So whatever it is excreted through here, sometimes it gets accumulated in the body. So echinus is the gas exchange unit of the lungs and comprises branching respiratory bronchioles leading to cluster of alveoli. So the larynx and large bronchi has rich supply with sensory nerve receptor involved in the cough reflex. Echinus is the gas exchange, the place where the gas exchange unit of the lung, and comprises branching respiratory bronchioles leading to cluster of alveoli. So as the bronchi, that it's like a root of the trees, it divides into the bronchioles, and then the bronchioles comprises and leading to the cluster of alveoli, the small grape-like structure at the base of the lungs. So if we go to the next slide now, so the flow of air. The flow of air, if we talk about how it goes, we have two modes. The one is the nasal passage, the one is the mouth. Some people are mouth breathers, and people mostly use that. They ask you to breathe through your nose. So this is the flow of air from the nose, from the mouth. Then it goes to the pharynx, to the throat, then to the larynx, then it goes to the trachea, that is your air pipe. Then it goes to the trachea, then the right upper lobe of the lung, then the right bronchus. Here, through the right bronchus, it goes and come to the whole part of the lungs, then to the middle lobe, then to the right lower lobe. Then we come to the left side, it comes to the left upper lobe and the left lower lobe of your lungs. And this is the outer covering of the lungs that we call the pleura, that protect the lungs from deflate. So right lung, if you see, which is the red part, that is the oxygenated rich blood here which is going, and the blue part, that is the oxygen poor blood. that mostly goes over there, if you can see in the middle part of your lungs. So if we come to the next slide now after this. So asthma, what is asthma? Lung disorder. What is asthma or lung disorder? A disease with reversible airway obstruction. It is a disease with reversible airway obstruction. So it is reversible airway obstruction when the breathing pattern gets reversed over there. So what is the main symptoms? People feel tightness in chest, right? Tightness in the chest, the muscles get overspasmed, right? Your intercostal muscles get into the overspasm sometimes. Wheezing is there, like the sound is like this kind of sound you always hear with the person who has asthma. Then there is a cough. Cough, the healthy cough sometimes, and sometimes phlegm or sputum. And it changes the color of the cough also sometimes. Episode of a acute attack. And there is episodic attack, the various episodic attack that will happen after the short duration of time in a day. So these are a disease with reversible airway obstruction, tightness in chest, wheezing, cough, phlegm, sputum, and episodes of your acute attack in a day. So if we come to the next slide now, after this. So definition, it is an obstructive pulmonary disease. What it obstructs now, this is the question. What it obstructs, basically the bronchi, what we say in the asthma, what happens to the bronchi, we call it bronchospasm. What do you call it? Bronchospasm. So the passageway get more narrowing, right? The passageway, like these are the bronchi, so bronchospasm happens, the passageway get narrows. So the flow of the air is being affected. So it is an obstructive pulmonary disease characterized by hyper-responsiveness of your bronchial mucosa. So the bronchial mucosa that is around, it becomes hyper-responsive, causing narrowing of the bronchi. So bronchi becomes narrow. Response to a wide range of stimuli resulting in cough, wheeze, tightness of chest and shortness of breath, which is worst during night. Why it is worst during night? Because there is lack of movement. When you're laying down, there is lack of movement and the spasms get more higher that time. In the daytime you are moving, so maybe sometimes spasm get reduced, but in the night time, mostly the chest is resting over there and there is no movement on the rotations, on the flexion, extension, so maybe more construction happens over there. So this is how the definition we say, the obstructive pulmonary disease by hyper-responsiveness of your bronchial mucosa. Narrowing of the bronchi to a wide range of stimuli resulting in these symptoms, that is cough, wheeze, tightness of chest and shortness of breath, which is worst at the night time. So if we come to the next slide now after this. So two types, the one is atopic or early onset, that is extrinsic. The cause is extrinsic, like sometimes dust is there, sometimes polluted environment is there, sometimes a fume, right, smell. So this is extrinsic. Late onset, that is non-atopic, that is intrinsic, the internal factors, some inflammation, some pathogens that creates inside your lungs, that will affect the asthma. So two types of asthma we have. The one is atopic, early onset, extrinsic, late onset, non-atopic, intrinsic. So next slide is, what is nasal allergy? Right, the nasal allergy, this is hyper reactivity of nasal lining. So when anything becomes hyperactive, so that works with high speed and that causes the damage. Not in relation to the respiratory system, if you're talking about the cardio system also, when the heart is working too much harder, it becomes hyperactive. We call it high blood pressure. So same thing here, when there is a hyperactivity of your nasal lining. In this area, the nasal lining becomes hyperactive. So running nose is there, sneezing and blocking. Right, the running nose, sneezing and blocking, so it becomes more narrowing of your this nasal cavity. So the air passageway affects that time, and less amount of air reaches to your lungs, and that affects more inflammation and increasing more inflammation and decreasing the level of healing over there. So this is about the nasal allergy, how it becomes when the hyperactivity, reactivity of nasal lining. So that leads to the running nose, sneezing and blocking. So we go to the next slide now. Asthma how? Right, the asthma how? So asthma is a bronchospasm plus inflammation. Inflammation and swelling of the lining, thick sticky sputum. So if we see here, generally, if you look at here now, the shape and size, here we bind it. So when we bind it, something restricted, right, it's narrowed, and you can see this bronchospasm. So it becomes more swelling there, more swallowing. So this swallowing, when swelling happens here, if it is swallowing there, what will happen? So from where it binds, less of amount of air travels here, but we have to exhale the amount of air also. So that's why we say this hyperventilation of the lungs. The hyperventilation of the lungs. And then this bronchospasm also creates the inflammation. And when the inflammation begins, it affects our cells, tissues. So the tissue death, cell death happens more reoccurringly here. So asthma is bronchospasm plus inflammation and swelling of the lining and thick sticky sputum, then it becomes appear there. So this is about the asthma, how it happens. It is because of the bronchospasm when it happens. So it narrowing the lining over there and swelling of the lining here, and that thick sticky sputum appears over there, and that forms inside your trachea. So we go to the next one now after the bronchospasm. So psyche, like in the parasympathetic, sympathetic activity becomes more higher. So in the psyche way, if we're talking about when the person is a parasympathetic, and if you're taking a too much stress, that also triggers the attack of your asthma. So person who has a sympathetic hyperactivity more in the daily life, or the sympathetic stimulation is more in the body, they are more prone for this asthmatic attack in comparison to the parasympathetic one. As we say, the sympathetic one is for fight or flight, and the parasympathetic one is for rest or digest. So then go to the next one. The causes of asthma. The one is heredity, the DNA, which we call the genetic, genes. Personality type, allergies, common families. Sometime in the DNA, what we call sometimes the asthma is genetic. There is a DNA code that matches, so it is in the diribose nucleic acid. So it's genetic sometime it is on the personality type. The person who is more thin, leaning, more chances of the asthma. In the obese people, there is a more chances of the asthma. And the allergy is common in families, like some people have in the whole family, they have a problem with the high smell perfumes, high smell fumes, with the feathers, right? Sometimes with the dust, the whole family affect, like in the genetic way with the DNA. So if we go to the next one after this, so non-specific also sometime, gene and identified. So this is non-specific gene identified that can also cause the causes of asthma. So if we go with the next one, so cause of asthma, what it triggers, external, internal. In the heredity, external, that is non-specific. Sometimes non-specific, any kind of things can be affect over there. Sometimes in the specific, like some type of smells over there, some type of food also like can trigger the asthma, like cold food, packed food, rice is there, right? And more cold things if we are eating, so that maybe the more chances in the winters that can cause. In the season also sometime seasonal, like in the winters, in the autumn, like sometime people have the seasonal asthmatic variations are also there. So sometime non-specific, specific or seasonal. So this is the external one. Internal one, emotions. Right? When you emotions, if you are holding the unwanted things inside, that triggers the level of stress. Anxiety, right? Anxiety can also trigger the level of stress, and that triggers the level of asthma also, because when anxiety and stress comes together by holding an emotions, the unwanted emotions which we don't want in our life, that time you feel that it triggers your hyperactivity of the body. It triggers the hyperactivity of the body and breath changes automatically. And if this is happening for the longer duration of time, right? If this is happening for the longer duration of time, that affects your internal system of the body after some times. Sometimes it is perennial, like the running nose and the constriction of the nose over there, and sneezing, coughing, and elderly also. The elder people, as we know, as how we get elder more in the advanced age, our breathing pattern, the respiratory rate becomes more higher. And sometime when it connects with these kind of things, like season variation is there, at the type of food, sometime with a genetic way, so it can cause into the elderly people also. So this is, we say, external factor, non-specific, specific and seasonal. Internal one that comes from the emotions, perennial and elderly people. So if we go to the next one after this, so non-specific, dust, smoke vapors, strong smell, scents, changes in temperature, humidity, weather, winter, summer and exercise. So weather is winter and summer, and sometimes exercises also, like high intensity exercises. If you are already asthmatic, right, and there is no flow of the breath, no flow of the air, it becomes sometimes hyperventilation. And any kind of infection, right, is any kind of infection. So these are some non-specific causes of the asthma. So move to the next slide. Specific is your some antigen, proteins, some antibody and immunoglobulins. So this is with the internal system of the body, sometime with the antigen, some antigen which in your different types, and proteins, antibody which developed inside the body, and immunoglobulins, that is IgE. House dust mite, sometimes pollen, food like fish, egg, milk and pulses, and sometimes your fungi, that is your fungus. So these are the specific is antigen, proteins, antibody and immunoglobulins. House dust mite, pollen, food in the food, fish, egg, milk, pulses, etc. And the fungi, that is your fungus. So move to the next one after this. So causes of asthma, triggers, internal, personality, thin-built, intelligent, emotionally sensitive people, as we have discussed, inability to express, suppressed feelings. So there is no need to hold. How much you release, it releases the tension from your muscles from here also. It releases the tension from the posture also. It releases the tension from your fluctuations also, and make you stand more tall, straight, and that can change your personality trait also. So if she cannot cry with tears, she wheezes and sneezes. It's written over there now. If she cannot cry with tears, she wheezes and sneezes. And then it can change to the asthmatic problems. So go to the next one. Incidence. It's 10 to 20% population. This is affecting. Prevalence is nowadays increasing. Mortality due to asthma unchanged in spite of medical advances. So mortality due to asthma unchanged in spite of medical advances. So 10 to 20% population that is affecting, and nowadays this prevalence increasing day by day, at the level of stress is increasing, lifestyle and the weather. And mortality is unchanged of medical advances. So move to the next one after this. Clinical feature, episodic. Episodic asthma which is come into the intervals. Like for the short duration of time, after that symptoms disappear. Then it comes, after that symptoms disappear, which comes into the episodes or in the short intervals. So no symptom between episodes. So between the episode to episode, there is no symptom between the episodes. Paroxysm of wheeze and dyspnea. So dyspnea, disturbance over there in the oxygen level of your body, right? So there is a disturbance of the oxygen level of your body. It triggered by allergens, exercise, viral infection, example, cold. So mostly in the winters, if you have seen, people have different breathing pattern, right? The different breathing pattern, that's why we say that keep your body warm. Otherwise, in the winters, mostly what happens, there is a vasoconstriction of your blood vessels. And that can lead to the bronchospasm inside also. And that can lead to the episodic asthma, which comes into the episode, and there is no symptoms between the episode. Paroxysm of wheeze, so wheezing, and dyspnea, right? Dyspnea I have either. So here is a dyspnea, and triggered by the allergens, exercise, viral infection, example, cold. So if we move to the next slide now, clinical features, severe acute asthma was known as status asthmaticus. The status asthmaticus, which is maintained. Life-threatening situation sometime, so we have to do some cardiopulmonary resuscitation. That time we have to do cardiopulmonary resuscitation. Or if you have seen that inhalers, right? The inhalers are there that people take in that emergency situations. Orthopnea, short of breath on lying. When you're lying, short of breath, orthopnea. Unproductive cough with respiratory distress. So not productive cough, unproductive cough, and there is a respiratory distress over there. So this is some clinical feature of severe acute asthma was known as status asthmaticus. Life-threatening situations comes. Orthopnea, when you're laying down, there is a shortening of the breath. That's why we have asked the people not laying down completely, just resting from the upper chest. So there is no extra stress on your diaphragm and the lungs. So there is little bit widening of the lungs, so that becomes release the muscles of your intercostals and the airflow gets into the normal way. So if we come to the next slide after this, chronic asthma. When we are going to talk about the chronic asthma, chest tightness, always you feel the tightness in the chest, breathing pattern disturbed. Wheeze is there, breathlessness on exertion. As you going for some sternness, as you're trying to go for some sternness or activity or doing too much exertion if you're taking. So that time you feel breathlessness mostly. Spontaneous cough and wheeze during night. Spontaneous cough as you're laying down sleeping and wheeze you feel. This type of sound comes. Episodes of severe acute asthma with respiratory infection. So you can see the episode of severe acute asthma and infection persists inside the lungs or the whole respiratory tract. So these are the symptoms of your chronic asthma. So move to the next one after this. So during the attack, the chest is held in the position of full inspiration. So during the attack time, the chest is held in the position of full inspiration like this. That's why what we need? Hyperventilation. Because chest becomes like, when you're doing full inspiration, held in the position of full inspiration, like this. So decrease breath sound with rhonchi. So rhonchi is your breathing sound. So decrease breath sound with rhonchi. Silent chest during severe attack. You cannot feel any movement on the chest. The silent chest is there. That time no breath sound you can hear. And if you have seen the pigeon chest, the chest becomes like this, the pigeon chest. So this is with the clinical feature. During the attack, chest is held in this position of the full inspiration like this. Decrease breath sound with rhonchi. Silent chest during severe attack. And pigeon chest like this way. So move to the next slide now. Preventive measures. So pollens, try to avoid exposure to flowering vegetation. Keep bedroom windows closed if your house is around, or if your house is nearby around that type of atmosphere where more gardening vegetation is going on. Mites in house dust. Vacuum clean mattress daily. So clean the mattress daily by the vacuum cleaner. Shake out blankets daily. You have to shake out the blankets daily, so whatever the dust which is existing there, that can be easily get out. Or mostly we have suggested that person who has asthma, no need to do this shaking. You can ask other people to shake out, because that time also it can trigger the episodic asthmatic attack to your body. Dust bedroom thoroughly, so keeping the bedroom clean. So animal dander. So animal dander, avoid contact with dogs, cat, horses or other animals, because sometimes the hair is falling over there, so that can also cause some allergies, and the allergens, or take some allergens through your nose to the lungs, and that can also trigger the asthmatic attack. So move to the next one after this. So feathers in pillow or quilts. So substitute your latex foam pillows and turveline quilts. If this is kind of component you are using in your pillows and quilts, so try to change it with the cotton or sometime with the foam one. That will be more beneficial for you. Drug like beta adrenoceptor antagonist. So drugs, if you are feeling like this one, this is the chemical which is inside over there. So avoid all preparation of relevant drugs which is with the beta adrenoceptor antagonist. Foods, if you are talking about identified and eliminate from diet. Sometimes you have seen that fish, egg, right? Meat is there over there. Sometimes it triggers the asthma. So we have to identify, see which kind of food is triggering or we have a consultation with the doctor or with the dietitian. So we have to avoid that kind of food, like the container food we have to avoid, and more proteins we have to avoid. Sometimes it can also triggers that kind of specific things. Industrial chemicals, avoid exposure or change occupation, right? It's basically avoid the exposure. Like sometimes people has this silicon with the silica factory. When they work, they are sometimes polluted is there, pollution is coming where there is a fume is going more, fog is there. So at that time also it triggers the asthma. So we have to avoid the exposure to that particular portion of the factory or the industry, or otherwise if it is triggering too much to you, change the occupation. So go to the next slide after this. Management. Hyposensitization, because as we have seen, hypersensitization is there, hyperactivity is there. So hyposensitization, subcutaneous injection of initially very small but gradually increasing doses of extract of allergens. So this subcutaneous injection of initially very small but gradually increasing doses of extract of allergens. So that is also not good, because if you are doing it, taking it into the more in a daytime, or more with the increased range of or the repetition of that injections and everything, these chemicals, that will be not good to the body and increasing doses of extract of allergens in our body. So move to the next slide after this. Acute severe asthma, what we do, as you have seen, people have a severe attack, they already take them to the oxygen cylinder, put some oxygen nebulizers over there, high doses of inhaled beta-2 adrenoreceptor agonist, they give more. Systematic steroids and assisted ventilation that we all provide. This is basically in relation to the medical system. Next slide. Now, how yoga helps? This is what we have to learn about it. Panchakosha concept. Let's go for the next. The first is the Anandamaya Kosha. Second is the Vijnamaya Kosha, that is the perfect health. The Anandamaya, that is with the food, lifestyle, and the breath. Right? The food and lifestyle. That is the Anandamaya Kosha with your asanas, the movement. Vijnamaya Kosha, that is for the perfect health. Third one, next one. Manomaya Kosha, with the mind. Next. So after that, if you see here now, with the next, this is your Adhyavidas, right? Adhyavidhis. So how to help it? Basically, we have to work with the breathing system here, right? Work with the breathing system, that is your Pranayamaya Kosha. Pranamaya. So that is with the energy, with the flowing of energy in a natural way. Next slide. So lungs, next one. So Annamaya Kosha level. If you have to work on that Annamaya Kosha, the asthma management, so diet has to be sattvic, that is simple, vegetarian, avoid late, heavy supper. So we have to avoid the late, heavy supper, because after that the activity is not there, the pressure comes to the lungs over there, and it increases more wheezing and more tightness in the chest muscles. As the stomach gets more float, it creates the pressure on the diaphragm. It is not working properly initially in the asthma. As the breath shifts to the chest breathing, if it is too much full, it can create more damage, more pressure to your diaphragm, and diaphragm automatically shifted the breath to the upper chest muscle, and as we have discussed, there is a tightness in the chest. So there is a chances the asthma becomes more into the attacks. So avoid sensitive foods when asthma is aggravated. So that sensitive food you have to avoid when this asthma is activated more. Desensitize to sensitive foods during intervals of good season or remission. So you have to desensitize to sensitized foods during intervals of good season or remissions. Lifestyles of moderation, yama niyama, that you have to follow, like yama and niyamas that you have learned in the philosophy. So try to follow that different types of yamas and the niyamas, what to do and don'ts. So we have to follow the principle of philosophy in our life too, if we have to manage through these asthmatic attacks. Go to the next slide after this. Acute episodes, chair breathing you can take. So voluntarily control over involuntary nervous system. So trying to relax. And that for the chair breathing, we can use the bolster over there. The neck has to be relaxed. So slightly we place like this way and ask the person to relax your upper chest on the bolster, and the neck is relaxed also. So then we asked after that gentle breathing. Hands onto the side, relax. And try to relax the upper chest part. Panic reduced. Reduce the panic way. Relax body, mind complex. Reduce the demand. So we have to relax both the body, mind complex, and reducing the demand. Why 8-step in chair breathing? To maintain steady awareness of breathing for 20 to 30 minutes. So you can get back your awareness to your normal breathing pattern to take all the things away from the external environment. So if you go to the next slide after this, Asanas, avoid none. We don't have to avoid none. We don't have to avoid any asanas. We have to do with the modifications. Because when the episodic attack is coming in the acute way, that time as you balance, as you get recover from that, guys, after that, a gentle movement of exercise if you do, with some modification and alignment, this will help you to increase your respiratory volume and the capacities also. So gradually build up to different posture and dynamic asana. Gradually, slowly and slowly. It's not person is already breathlessness and we are trying to ask them to directly jump into the Ashtanga practices or flow practices. Started with some warm up, gentle exercises, then traditional hatha way we have to follow. Complementary postures we can use. That is your restorative poses that we can use also. Drainage of secretion, forward bend. If you want to drain the secretion, so forward bend is good for the problem. We'll move to the next slide after this. So asanas, how it works. It opens up the chest because during asana, what the teacher has, inhale, up, exhale, down. Inhale, up, exhale, down. So you are focusing on your breath pattern also. And slowly and gradually it can open up your chest and improve the lung capacity. Backward bending, Bhujangasana, Dhanur, Ustrasana. So backward bending poses like your cobra, bow pose, camel pose, that helps you to open up the chest. General stamina if you have to maintain, we can use some dynamic asanas is there, Sithli Karna and Surya Namaskara. So this Sthil Ekarna, the Sthil Ekarna we talked about the more static poses, Surya Namaskara we can use and balance of prana. So it ultimately leads to the balance of prana, so balance of your energy. So when the energy is balanced, system comes to the balance automatically. So this is how we have to asana, how they work. Mostly we focusing like if we are doing 5 repetition of forward bending, so 6 to 8 repetition for the backward bending, open chest. The person who has asthma or that history of asthma or tightness in the chest and the lungs. So if we move to the next one, asanas, then better tolerance to exercise. It increases the better tolerance to your exercise. Stimulus, relax. So stimuli, that is relax. Graded gradual improvement of exertion tolerance. So it graded your gradual improvement of exertion tolerance. The body is prepared, so at the time of exertion, it can maintain easily. And it ultimately leads to your pranic balance. That's why we say keep moving, keep breathing. Keep moving, keep breathing. So the both physical body plus physiological body get into the balance. So next slide if we go through. So kriyas also you can use nasal cleansing techniques. Clean the passages. Neti you can use by water, by the thread. So it can cleanse your nasal passageway. Clear the digestion. You can use the dhoti. We have discussed that one. What we say when we eat the cloth and cleaning the whole respiratory tract over there too. Sankha Prakshalana, that is the cleaning of your whole body from mouth to anus with some postures and drinking the lukewarm water. Allergy, hyperreactivity. So allergy, it's work on the allergies and the hyperreactivity. So it gets into the hypo and there will be no allergy or no pathogens. So kriyas we can also use as the treatment, as a therapy. So if we move to the next slide after this, stamina building. So how it works now, kriya, build your stamina. If the nasal passageway is clear, so the flow of air is nicely, you can inhale and exhale easily. Jal neti, water, which we can use, non-specific irritant and accept. Sutra neti, that is rubber tube, stronger non-specific irritant. So this is the non-specific irritant easily which we can accept, but this is a little bit stronger when we are moving this thread over there, the rubber tube. So this is non-specific irritant. So graded gradually increasing stimulus on background of depressed. So graded gradually increasing stimulus on background of depressed. So that is also how it stimuli, increasing the stimuli on background of depressed. So that kriyas how it helps into the stamina building. So if we move to the next slide, my dear friends, pranamaya kosha, prana blocks, imbalance removed. Right left balance sub may help. So pranic, if this is closed, this is open, also gets into the problem. So with the prana, ideally recognize the nasal. So ideally you have to recognize the nasal, is it working on the balance, or one is blocked or one is open. Dominant to movement. So dominance, movement to movement, and correct the imbalance. So when you're doing some kind of these practices like Anulom Vilom, so sometimes which is dominant, one is not dominant. So it also leads to the balance. When we learn and bring our whole attention to the breath, it will help to open up and balance the both system and the both pranas. And this prana blocks, imbalance removed. As the imbalance removed, prana opens. Right and left balance, ideally recognize the nasal, dominance movement to movement, and correct the imbalance with the severe practices. How it, cleansing techniques and some pranayama helps to your body. So in the beginning with the asthma, we ask the person, there is no need to retention, no need to hold, just try to learn how to breathe properly first, because we have to change the breath pattern from mouth to nose breathing pattern. So no dynamic pranayamas we use, Anulom Vilom we use, some nasal cleansing we use, and then slowly and gradually we modified the speed and the repetitions. So if we go to the next slide after this, abdominal breathing is helpful. Training diaphragmatic breathing helps reduce effort of breathing. So mostly as we have discussed, it clicks or it transfers to the chest breathing. So diaphragmatic breath we have to use. That we call the abdominal breathing. So resting your upper chest, placing your hands on the diaphragm or on the belly, shoulder relaxed, so there is no upliftment of the shoulders. So abdominal breathing which we can use. Release pranic block in the chest, that helps to release the pranic block in the chest. Improves your digestion, more blood circulation goes towards your digestive organs. Bastrika improve general stamina. So you can use the Bastrika also, that improves your general stamina by doing the movement, the dynamic movement. So blood circulation circulates everywhere into your internal organs. So if we move to the next slide after this, Manomaya Kosha, meditation, if you are doing, that is the direct method to rest, ANS and immune system. So it rests your autonomic nervous system and immune system also, and ultimately leads to the stress reduction. When you have no awareness to the external world, just bringing the awareness inside yourself, talking, connect to yourself, different laxative techniques, different types of meditation you can practice. So that can lead to the stress reduction. So move to the next slide after this. So devotional sessions which we can use, which brings the energy more into the positive level. Emotion culture, replace emotional sensitivity by emotional mastery. So this devotional sessions, emotional culture is there, that replace emotional sensitivity by emotional mastery. So conflict arise because of emotional hypersensitivity. So these all conflicts or all the problems, all the restrictions, that is conflict because of emotional hypersensitivity. When the emotion get more hypersensitive, then it leads to the problems, and then it leads to the stress, and then it leads to the disease. So if we move to the next slide after this, Vijnamaya Kosa, yogic counseling, right? Yogic counseling, talking, releasing the things in front of the people where you feel comfortable, or bringing some yogic practices as a treatment or as a therapy to the person. Surrender to divine, nothing is mine. Just surrender to divine. Whatever we are doing, we don't have to accept. We don't have to expect anything. Whatever the result it is, don't become fair, go with the balance. Joy in joy of others, work in relaxation. Joy in joy of others. Don't be get hated, don't be get jealous if somebody is getting more higher. Work in relaxation. Work for 3-4 hours, but work with the relaxation. No need to work for 10 hours. Action, contentment, etc. So action in contentment. Happiness analysis, reduce rush and speed. Analyze your happiness, where you feel happiness, and reduce rush, speed, going here and there, pressure, this, avoid this. So that's how it works into your Vijnamaya Kosa. So these changes we have to bring into our daily life. Analyze the happiness also. Joy in joy of others. Work in the relaxation phase. Surrender to divine. Accept whatever it is. And yogic counseling. If we move to the next slide after this. Anandamaya Kosha, Anand is the bliss, happiness. Just bliss and happiness. When nothing is with you, no expectation. Because the way I say, expectation always hurts. We are doing without any fear of result. We are in a bliss. When we are laughing, dancing, whatever we are doing, when we are enjoying, we're in the bliss. That is the Anandamaya. So switch off to dwell in inner bliss frequently. So switch off to dwell in inner bliss frequently. Recognize that are made of that stuff, Anandamaya. So the stuff is Anandamaya, that is the happiness and the blissfulness. Can expand and slow down. So focusing on the inner body, inner mind, inner self, love yourself, dance, meditate, spend time with the nature. So where you feel laughter is there, that I am the Anandamaya, I am the state of bliss. You have to follow that. And that comes to Anandamaya Kosha that you find when you balance the all other koshas. Then the journey leads to here. So if we move to the next slide after this. So integrated yoga modules for asthma, breathing practices. Hands in and out breathing you can use. So hands in and out breathing you can use. Take your hands in, inhale. So in the hands in and out, when you're going out, when you in, you can take into the rest also. If the problem with the chest opening, you want chest opening also easily. Slow and dynamic movement. Hand stretch breathing. Or simply you can do this way also. Ankle stretch breathing during inhalation, exhalation. This you can do. Dog breathing. So taking your tongue out. This you can do. After that, rabbit breathing you can do. Sit into the Dandasana, into the floor. Keep your one leg right to move and trying to sit on your right ankle and trying to bend forward how much you can do. Bend this knee, place your hands and just inhale, exhale. So this is good for your middle lobe, the lungs, that creates some pressure over there and trying to improve the lung capacity on your middle lobe. Then the rabbit breathing we have done, dog breathing we have done, then tiger breathing that you can do like this way. with your own speed. Shashankasana breathing. So in the Shashankasana, we have to laying down into the Shashankasana pose. You can place your fist under your abdomen and bending forward, holding it in your lower lobe, working on the lower lobe here, then stretching, and then breathe. Inhale, exhale. And easily again take the both fist onto the lower lobe, onto the abdomen, pressing slightly. Inhale, exhale. And then stretch completely. Then straight leg raise breathing you can do. You can do in the laying down or you can do in the straight leg. Or in the laying down also, hold. Instant relaxation technique. Any instant relaxation technique you can use over there. So this is the 8 type of breathing which you can use into the chair or into the laying down position. So if we go to the next slide. So gentle forward and backward bending, loosening exercises we can do, side bending we can do, and Pavan Muktasana Kriya, Pavan Muktasana series, the wind releasing series, right? The wind releasing series we can practice. Quick relaxation technique we can do. If you're talking about the yoga asanas in the standing posture, so Ardha Kati, Chakrasana, Ardha Chakrasana, Padahastasana. So Ardha Kati Chakrasana, which we can do the half way, like this way we can move. So half spinal twist and holding here. So improving the spinal flexibility plus opening of the chest. Ardha Chakrasana, this you can do, some people do completely. So simply you can do and no need to create any pressure on the lower back. Just hold over there and release the pose. Then Padahastasana. Including inhalation, exhalation, bringing the hand under the feet. This Padahastasana you can do. So this comes to the standing poses. Then come to the next one. Sitting poses, Vajrasana, Vakrasana, Ardhya Matsyendrasana. So this twisting you can do. Paschimottanasana, lifting forward bending. Then in the prone position, on your belly, it's basically Bhujangasana. Gradually, as you are improving your capacity, then Cobra, this Salab locust pose you can do. In the supine posture, the Sarvangasana, that is your shoulder stand. Matsyasana, that is your fish pose. Improve the lung capacity, opening of the chest, and some deep relaxation techniques like Yoga Nidra, some yogic meditation that we can practice. So move to the next slide after this. So pranayama, Surya Anuloma Viloma pranayama, that is with your sun, alternate nostril breathing. Chandra Anuloma Viloma pranayama, that is your moon, to balance both the energies, and to Nadi Shodhan pranayama, that is your Nadi Shodhan. Sitli Sitkari, Sadanta pranayama you can do, the Sitli one, that is your cooling pranayamas. Brahmari, which we can use also to calm down your nervous system and bring more relaxation to your brain. Meditation, Nada Anusandhana. That Nada Anusandhana meditation you can do. You can do Om Dhyan, Om chanting internally. And some cyclic meditation also you can practice. If we come to the next slide after this. Integrated yoga module for asthma, breathing practices, hands in and out breathing, ankle stretch breathing, tiger, rabbit, dog with the eyes closed, straight leg raise, back stretch breathing you can use easily by stretching your back on the laying down, on the sitting on the chair. And this breathe, inhale, exhale. Then tiger stretch, yoga chair breath you can do easily by relaxing your upper chest. Shitli Karna, Vyama, that is loosening exercises. So that is Pavan Muktasana series you can do, the wind releasing, right? That which we can do. Sun salutation after that to release your joints and the muscles. To move to the next one. Yogasana, as we have discussed, all the posture, this Ardha Kati Chakrasana, Padhasta, Ardha Chakrasana, Vakrasana, Ardha Matsyendrasana, Cobra Bhujangasana, Salab Locust Sarvangasana, that is shoulder stand, Matsya Asana, that is your fish pose, and deep relaxation techniques. So this way you have to move with this module, like, can you go back to the backslide back? So this is the integrated yoga module, starting with some breathing practices first, then some loosening exercises, right? First breathing concentration, slowly and slowly come to the joint release exercises, then come to the Surya Namaskara to stress the muscles. First release the pressure from the joints, then release the stretch and get out the muscle contraction, muscle tightness away from the body. Come to the next slide now. Then we go with this kind of postures, starting with simply Chakrasana, Padhastasana, so backward bend, forward bend, then in the last shoulder stand, and Matsyasana, a slight chest opening over there, and end with the deep relaxation techniques. So next slide. Pranayama, then we see if the progress is going on, then we Kapalbhati, sectional breathing, that is diaphragm, then the mid chest, and then the upper chest. This is we call this sectional breathing. The sectional breathing, breathing to train lower lobe, middle lobe of the lungs, and the upper lobe of the lungs. Surya Anuloma, that is with the sun one, then Nadi Shodhan, Brahmari, meditation, Nada Anusandhana, Om meditation, and Kriyas also which we can use, the Jalaneti with the water, Sutra Neti with the rubber, Vamandhoti, that is just drinking the warm water with the saline one, and then vomiting. So it clear the whole respiratory tract also. Sometimes because of digestive issues that affects your respiratory tract. So this is the module for your asthma. So next one, if we go. So specific practices, yoga tries to cure asthma by cleaning the lungs and making patient emotionally strong so that she does not react to stressful situations. So physically, if you are going active, by breath, you are practicing different pranayamas. So breath is also in balance. Meditation, mind is also in balance. So it becomes, make you more strong. So it does not react to the stressful situations. As the disease is primarily of the lungs and respiratory system, the pranayama and asanas selected are to restore the health of lungs and the respiratory system. So that's why we have designed the schedule, this module over there, the practice of asthma, like not too much dynamic asanas, the category of the posture which we have used that works on your this area, the respiratory tract, and the pranayamas that balance your respiratory rhythm. The posture prescribed, drain mucus from the lungs and relax lung muscles. Simple, fundamental is there. So drain the mucus out from the lung and relax the lung muscles. So there is no busyness, no tightness, no stiffness on your chest. Yoga also teaches to breathe correctly, as we have discussed before, the different sectional breathing. So bring the awareness on the whole part of the chest. So yoga not only clear lungs, but also gives the will power to give up smoking through meditation. So these are the different meditations also there, that when the level of stress becomes more higher, the meditation, if we practice, it took us to the calm and the silent environment. So if the level of stress is not there, there is no urge to smoke, no urge to drink. So sometimes people who has a repetition in the minutes, in the hours, they are smoking or increasing the chances of drinking also. So bringing the alertness, awareness, when it comes back to yourself, we don't have to go away from ourselves. We have to bring the attention back. So that will help to maintain some silence in your inner body, and you can connect yourself easily. So go to the next one. So the breathing exercises oxygenate lungs and increases their flexibility. So by strengthening immune system, they also reduce dependency on medication. So if the immune system is strong, healthy, reduces the chances of asthma or these attacks and reduce the dependency on medication also. So daily practice, Jalaniti, Bhastrika, Nadi Shodhan, Ujjayi Pranayama. So pranayama massages the bodily cells and inner organs also. Next slide. So general consideration, this problem is often associated with bronchitis or allergy. It starts with the bronchitis, inflammation in the bronchi or some type of allergy. So when we are not focusing, not treating properly, it becomes to the asthma. There are few contraindications to yoga for patient with asthma, which is not complicated. Example, acute bronchitis, little bit avoid or go with these sign and symptoms. Observe, right? Observe the student and their sign and symptoms. Then slowly get into the practices. The environment in which yoga is practiced should be as far as possible free of the substances which may cause allergic reactions. So cleaning, as we say, no dust cleaning or no foggy or the smoky atmosphere around the yoga hall. So recommendation, these patients often benefit from many yogic practices including relaxation and meditation. You can see the publication of the Bihar School of Yoga. So many things has been written on the books over there. So this is how the yoga helps and how relaxation, meditation, power of postures and power of breath can change your life. Next slide. So this is chair breathing. Ekpada Uttanasana helps in activating the bronchial lining. It helps in activating your bronchial lining so it becomes not every time hypersensitive. Tadasana strengthens the bronchioles and lungs and build up muscle of chest. The posture of the person with the asthma is like this. So when you try to stand on Tadasana, it strengthens the muscles of your chest and bronchioles and lungs. Camel pose, it activates facial tissues, the nasal passage, the pharynx and the lungs. Lion pose cures throat trouble, voice deficiency and tonsillitis and activate your larynx, trachea and all bronchioles and invigorates the thyroid cartilages. So these are some posture also which we recommend with any kind of imbalances to your respiratory tract, not only the asthma. In other acute inflammations, you can use these postures also. Sarvangasana, the shoulder stand, corrects any disorder of circulatory system because cardiorespiratory, they work along together. Right? They work along together. So it corrects any disorder of circulatory system to take the blood out, to take the blood back to the heart. As the gravity changes, so veins can drain the blood easily, so lymphatic drainage can be get more better and it strengthen your immune system too. Fish pose correct the disorder of the respiratory system as all organs concerned with respiration such as the nasal passage, the pharynx, the larynx are exercised systematically here. Padmasana, lotus pose relaxes the body, appropriate asana for pranayama, the lotus pose. Savasana, corpse pose, remove fatigue and quieting the mind must be practiced at the end of session. Then pause for half a minute between the asanas. So take the pause for the half minutes or depends upon the client. If they need 2 more, you can increase this pause between the poses. So I hope this must be clear to you guys, what we have discussed, causes, symptom, the poses which we have to use and how to use it, how to practice the whole method, right? The whole protocol, the category of the postures, the category of the pranayamas. So we don't have to practice all the poses one day. You can take one protocol, one mixed type of poses that helps you to get rid of asthma and you can bring back your students to the normal healthy lifestyle with the normal respiratory breathing. So I hope you enjoy this class. Till then, namaste, have a nice day.